What's up, Internet? How's it going? It's Friday. I think people are very confused about my position on Nick Shirley, and they think I'm just name dropping for attention. That would not be good for my day job, so just kind of take a breather and step back and consider what you don't know, because it's quite obvious to me that the people who are taking issue with what I'm saying have no experience, and that matters, and that's okay. It doesn't mean you're stupid, okay? Just again, take a breather. The issue that I have is that everything with this kid who has zero healthcare experience is completely misrepresented. He is running around accusing people of fraud, and again, I'm not suggesting that what these people are doing isn't shady, because I definitely think it is. But he is jumping to conclusions, much like most of you are, because he's a shock jockey, and he has somebody like Dr. Oz, doing videos with him, and people think, oh my God, that like legitimizes him. No, believe me, I actually agree with the direction of his claims, but it's possible that people are just abusing the system, and there's a lot of waste there. That's not necessarily the same thing as fraud, and you cannot conclude, especially that there's fraud, based on the Doge Medicaid utilization data dump that we got back in February of this year. There's not enough information there, okay? Not a feeling. I've mapped that data myself. It includes just only a handful of variables. Those are total unique beneficiaries, total paid claim line items, total claim lines, along with associated MPI numbers. That can be the billing provider or the actual provider themselves, along with a month. That's, it's monthly data. There's a timing issues there, and there's tails cut off, so you won't see like a lot of these like small claims running through there. The entire suite of TMSIS data, the national repository, includes all sorts of demographic data, especially it expands on things like all things managed care, so encounters. That matters because at a national level, this is true even in the state of New York, growing share of the overall spend is related to MCO. So I take issue with that because he's misrepresenting things. Okay, why has he not brought up the fact that really adult daycare, those HCPCS codes S5102, S5105 are not only very outsized in Flushing, Queens, but also next door in Brooklyn? Why didn't he mention that? Also, the provider he takes issue with did $45 million in billings over 5 years. The state does $100 billion a year in Medicaid spending.